joining us for today's virtual media briefing about COVID-19 in London and Middlesex County. We're joined today by London Mayor Ed Holder, the Acting Medical Officer of Health for the Middlesex-London Health Unit, Dr. Alex Summers, and the Chief Medical Officer for London Health Sciences Centre, Dr. Adam Dukelow. We'd like to welcome the media who are in attendance for this afternoon's briefing and invite them to submit their questions using the question forum here on Microsoft Teams. We'd also like to welcome those tuning in this afternoon on Rogers Television, Rogers Facebook page and YouTube channel, those listening on News Talk 1290, and those watching on the CTV London website. We'll get to the opening statements right away, and we'll start with London Mayor Ed Holder. Mayor Holder.
Well, thanks, Beth, and good afternoon, everyone. I'm pleased to say that, like thousands of other Londoners, I was able to book an appointment this morning to get my third dose of COVID vaccine for later this month. I'm grateful to the Health Unit for designing such a straightforward and easy-to-use website, and I'd also like to offer my deepest thanks to all those who continue to staff our Vax clinics with the incredible dedication and professionalism that they show. If you're eligible for a booster, now is not the time to wait to book for an appointment. The same goes for anyone in need of a second shot or kids aged 5 to 11 still in need of a first. Do it now. The Omicron variant's here, and we're seeing new evidence on a daily basis how aggressive it is with respect to transmission. And as alarming as these numbers might appear, and as deflating as they may seem to you who have done the right thing by getting your shots, I want the 90% who've been vaccinated to know your efforts are making a difference. Instead of case counts, look at hospitalizations, look at ICU admissions. Across Ontario, both of those figures are half of what they were this time last year. That's despite the fact that all aspects of our economy are fully reopened with no restrictions. All sports and recreational facilities are operating at capacity. We have all these things we did not have at the same time last year. And in spite of that, hospitalizations and ICU admissions are half of what they were last December. Locally on this day, we had 39 in hospital. Today, that number is 13. The difference, of course, is that between then and now, 90% of our eligible population has done the right thing and gotten vaccinated. It's why vaccines are so important, and why even with the breakthrough cases, they are your best defense against getting extremely sick or worse. And the numbers demonstrate that consistently. Let's keep our economy open and hospital beds clear by getting the shots we need. It's that important. In addition to vaccines, we must absolutely ramp up our testing capacity. I don't care how it's done, but it needs to be done, and I'm encouraging the Ontario government to act. None of these tests should be sitting in storage. They should be widely available to every Londoner and every Ontarian who wants one. We see this being done in other countries and other provinces in our country. We need to be doing this here in Ontario, and we need it now. Anyone in London who wants to book a COVID test at Carleen today has to wait until at least Friday for an appointment. That's not good enough. But it's not the fault of Carleen. Flooding the region with take-home testing kits would surely relieve the pressure of these testing clinics. We have options we didn't have 2 years ago, and we should be using them. If we don't have enough kits, we should be buying more, because the time is now. I will say, and as a reminder, that there are rapid antigen test kits still available through the London Chamber of Commerce for any business with less than 150 employees. If you haven't already, or if you need more, I encourage you to visit staysafelondon.ca to secure additional supply. Again, that's for businesses with less than 150 employees. It's a great initiative, one that'll keep Londoners safe, but as mentioned, the time has come for these tests to be made available to everyone, and I hope we see that happen sooner than later. That's it for me. Over to you, Dr. Summers.
Thank you, Mayor Holder, and good afternoon, everyone. Thanks for joining us on this Monday afternoon. Case counts are rising rapidly. Middlesex-London is reporting 75 new cases today, and our total active caseload is now 445 people. This comes after a weekend where 58 cases were reported on Sunday, and the day before that, 43 cases. In the face of the Omicron variant, we are seeing exponential growth in our region and across the province. I now consider the Omicron variant to be the dominant strain in our region, and it is rapidly becoming the dominant strain across the province. The challenges of the Omicron variant are many. Omicron is showing increased transmission compared to previous variants. It's estimated to be 2 to 3 times more transmissible than the Delta strain, and that is certainly what we're observing here locally. As an example, in England, they're seeing a case doubling time of around 2 to 3 days. The vaccine effectiveness for symptomatic infection is clearly reduced compared to previous variants. Building on the mayor's comments, though, the vaccine remains the most important thing that we can do right now to protect not only against symptomatic infection, but most notably, potentially hospitalizations and death. The severity of the symptoms caused by Omicron remains unclear, as is the impact of 2 doses of the vaccine on hospitalizations and death. Most cases to date across Ontario and across the world, particularly amongst vaccinated individuals, have been asymptomatic or mildly symptomatic. However, it remains too early to make any conclusions about the long-standing impact of this variant. It will take higher case numbers to see increases in hospitalizations and death. However, hospitalizations and death are a lagging indicator, which means we don't see it till after the peak in case counts. And a profoundly high number of cases will still lead to increased hospitalizations and death. Vaccines should continue to provide some protection against severe illness and death. And for those of you who have gone out and got vaccinated, thank you. It helped us through the Delta wave, and it will still help us through the Omicron wave. However, it's becoming increasingly clear that boosters will be required to partially restore vaccine effectiveness. In response to the rising incidence of Omicron in our region, you will be seeing expanding access as well as expanded urgency to get your booster dose. The Middlesex-London Health Unit and our partners are increasing capacity locally to provide booster doses to individuals 50 and over. These are the individuals that are most likely to be hospitalized if infected with COVID-19, and therefore our focus. Earlier today, the health unit announced that we'll be increasing vaccine clinic capacity, in January through expansion of the Caradoc Community Center Clinic for 5 days a week, expansion of Agriplex hours, as well as the reopening of the Earl Nichols Recreation Center, operating Monday to Friday as of January 6th. However, in addition to that expanded capacity and in anticipation of the rising Omicron incidents in our region, the health unit is also expanding capacity between now and December 24th. We have a short window in which to vaccinate as many people 50 plus as possible. You will see Agriplex mass vaccination capacity expanding starting this Thursday, as well as expanded days at the Caradoc Community Center starting next Monday. This is a targeted blitz to boost as many individuals as possible in the next 10 days. Pharmacy capacity is also increasing, so if you're not able to get an appointment at an MLHU-operated clinic, make sure you check out your local pharmacy as well. Since Friday, over 12,000 appointments have been booked. We anticipate more appointments booked over the next little while. Even today, an additional 6,000 appointments have been added between now and December 24th. Please do not hesitate in getting yourself booked, and I know the mayor has taken at least one, well, not at least, has taken one of those appointments, and we're grateful to him for his leadership in that way. Please get vaccinated, and if you are eligible for a booster, get that booster dose as soon as possible. The health unit is also modifying our management of COVID-19 cases under the assumption that they are the Omicron strain, as well as to deal with the anticipated and real rise in cases we are seeing. Effective today, all close contacts, regardless of their vaccination status, will be required to quarantine for 10 days after their last exposure to an individual with COVID-19. They will also be asked to be tested on or after the 7th day following their exposure in order to exit quarantine. Close contacts may not be directly notified by the Middlesex-London Health Unit as we start to see these cases rise. Instead, you may be notified directly by the individual who tested positive for COVID-19. If you are notified, believe what is being told to you and quarantine and get tested. This updated management of cases requiring back quarantine for all close contacts will impact a number of different workplaces, most notably our schools. You will have heard from the school boards today that because of operational constraints due to vaccinated teachers having to quarantine, there have been some additional school closures. We're working closely with our school board partners to navigate this and recognize the impact that this is having. It's critical to note, though, that in the face of the Omicron variant, we truly need to be precautious. Lastly, I just want to highlight and emphasize the recommendations that I made with my colleagues from Huron-Perth Public Health and Southwestern Public Health last Thursday. We laid out a series of recommendations as we enter the holiday season, particularly in the face of the Omicron variant. I need to restate those recommendations in no uncertain terms. We are in the face of an exponential increase in COVID-19 cases, including amongst individuals that are fully vaccinated. I'm asking everyone to limit their close contacts as much as possible. It is time to cancel plans. It is time to avoid indoor gatherings that are non-essential as much as you are able. Even if you are fully vaccinated, it is critical that we limit contacts as much as possible. What we do outside of our essential activities, like kids going to school, will be critical to ensuring that we can keep schools functioning. We are seeing the impact of having to quarantine teachers right now. So again, I'm emphasizing as we enter the holiday season, this cannot be a holiday season like others. It is a daunting and frustrating situation that we find ourselves in, and I want to thank everyone for their ongoing commitment to one another and to keeping each other healthy and well. Those that have rolled up their sleeves to get vaccinated, thank you. Those that are booking booster doses, thank you. Those that are getting tested when they have symptoms, thank you. Those that are staying home when they're sick, thank you. Those who are expressing and sending kindness to neighbors that are struggling through all of this, thank you. We continue to weather this storm, and we are grateful for our community, even in the face of yet another challenge. Again, thank you for your ongoing support of the health unit and of each other. With that, I'm going to hand things over to Dr. Dukelow from London Health Sciences Centre.
Good afternoon. Thank you, Beth, Mayor Holder, and Dr. Summers. I'd like to echo the gratitude that Dr. Summers just offered to a number of different individuals and groups of individuals for their efforts to fight COVID, despite all the frustrations that we're facing and that have increased just in the past few days and last week or so. As of this morning, we're caring for 13 COVID patients at LHSC, as mentioned by Mayor Holder. Five or fewer of those are in critical care. As well, we have less than five or fewer inpatients in our children's hospital. However, as has been discussed by those that preceded me on this conference, with rising case counts in our community and across the province, we are actively reviewing our current situation to determine if additional safety measures are needed at LHSC. At this time, as we are in a unique environment compared to other public spaces like shopping malls and skating rinks. We are assessing the potential risk to staff, physicians, and patients, and carefully evaluating how we can best serve our workforce to ensure wash your hands, and wear a mask. Thank you to our media partners for attending today, and I look forward to your questions.
Thank you very much, Dr. Dukelow, Dr. Summers, and Mayor Holder for those opening statements. We're going to get to the questions right away because we have a number in queue this afternoon. The first one comes to us from Jane Sims with the London Free Press. It is for you, Dr. Summers. Dr. Summers, the United Kingdom just announced one death associated with Omicron. How many Omicron cases here in London have been hospitalized? How severe are their illnesses?
Thanks for that question, Jane. Remarkably, in Ontario, there are no Omicron cases currently admitted to hospital. That is reassuring. However, hospitalization and deaths are a lagging indicator, which means that the case counts rise first, hospitalizations happen later. Our hope, our best case scenario, is that the Omicron virus causes mild, non-hospitalized symptoms amongst those that it infects, particularly those that are fully vaccinated, given that we have such high vaccination. That's a best case scenario. However, we still do not know whether or not that best case scenario is our reality. The severity of illness that's being observed in South Africa, as an example, has been fairly mild. However, it's been predominantly amongst young individuals. We've yet to see the full impact of the Omicron on older individuals who we know typically have more severe outcomes when it comes to being infected with COVID-19. So our current data is incomplete. To make any conclusions around the full impact of Omicron on illness and hospitalization is still early. Encouraging signs right now, certainly encouraging signs. And as the mayor noted, hospitalizations remain low despite the higher case counts. It's the lagging indicator that we need to monitor closely. And that's why we're asking for some degree, if not a high degree of caution to be taken at this time. I hope that answers that question. Thanks, Beth.
Thank you very much, Dr. Summers. Our next question comes to us from Jane Sims. It is for you, but I'm actually going to combine it with another question for the mayor from Jane Sims later on in the forum here. So Dr. Summers, Jane Sims would like to know, would the health unit consider handing out rapid tests for free this holiday season? And also for you, Mayor Holder, Jane Sims would like to know, is there any chance that the city would offer free rapid tests to any and all Londoners? So Dr. Summers, why don't we start with you and then we'll pass it over to Mayor Holder.
Thanks for that question, Jane. The availability and distribution of these rapid tests is done through the provincial government and through Ontario Health. And we are in active conversations around how to increase rapid test availability in our region. The Ontario COVID-19 Science Table released an evidence brief late last week, highlighting that in certain higher incident rates of COVID-19, that rapid testing periodically through the week, particularly amongst unvaccinated individuals, may help with disrupting transmission. We are taking that evidence to heart and are in active discussion with regards to how those tests may be available, particularly to places like schools and elementary schools moving forward. So that is emerging as we speak. I'll see if the mayor has any additional comments on that.
Yeah, thanks, Dr. Summers, and thanks, Jane. Look, anything's possible, but your question really speaks to two issues. One is the speed, that is the ability to get this out quickly, and the second is the capacity to distribute these tests. What the city doesn't have is we don't have a supply chain or a distribution network that makes that work. We do know that chambers of commerce across the province were given this opportunity to participate in the program that provided the tests to small businesses and those under 150 employees, and those who are greater than 150 employees would, the intention is that they go online, but there they have set up training, they've done a number of things. But again, while it is possible, I think the issue here is supply, and that's maybe the third point. That's why we're encouraging the government, if there is a provincial government, if there is a concern about supply, then we need to get it, and we need to get it now. And from a distribution standpoint, there's a number of potential distribution networks, and certainly pharmacies have been one proven area. where that has worked in terms of providing vaccines. So I don't think the supply chain and distribution network has to be an issue, but it has to be a commitment by the provincial government, A, to do this, and B, to ensure that we have sufficient supplies to take care of Londoners and those in Middlesex County as well. So that would be my thought. But in the world of anything being possible, I'm open to the province coming back with any suggestions that help put more of these testing kits made available to Londoners.
Thank you very much, Mayor Holder, for that response. I'm just going to look around the table here. We have 10 more questions in queue and about 10 minutes left. So if we're okay to go a little bit over 2:30 today, we'll take those remaining 10 questions today. Great. Thank you very much. Our next question comes to us again.
That's all.
Pardon me?
I'm sorry, I'm being cheeky. I said only if they answer quicker.
Well, we'll try our best here, Mayor Holder. Our next question comes to us from Jane Sims with the London Free Press. Dr. Summers, it is for you. Dr. Summers, how challenging is it to staff in the clinics? Obviously, there has been enormous burnout in the healthcare sector, and Jane is wondering if that is making this vaccination push more difficult. Do you need people to get shots in arms?
Thanks for that question, Jane. Yes, it is an ongoing challenge to staff our mass vaccination clinics with the increased numbers and demands that we're going to see over the next little while. We are fortunate to have great partners who are willing to continue to support us, and great staff and great teams that are continuing to step up to the plate. But it's been a very long journey. The same staff that are providing leadership at these clinics are the same staff that have been responding to case and contact management since January of 2020. So it's been a long, long road. We are continuing to onboard more immunizers each and every week. An additional 75 immunizers, I believe, will be onboarded over the next week. And we are turning to our partners in the community to help get through this blitz between now and the end of next week. But as all of my colleagues across the province in health, as well as within this city will note, there is a need for health human resources, the people that know how to do this work at all levels of health, be it in the hospital, in primary care, in public health, in laboratories, you name it. So it's a juggling act. And I am eternally grateful to our teams for the amazing work that they continue to do. A community sits grateful, I can tell you that much. Thanks for that question, Jane.
Thanks very much, Dr. Summers, for that response. And our next question comes to us from Jennifer Beeman with the London Free Press. It is for you, Dr. Summers, and it's about booster shots. And I'm going to combine it with another question from Carrie McKee from CBC London about booster shots as well. So Jennifer Beeman would like to know, Dr. Summers, how many booster appointments were booked in the opening hours of the 50-plus rollout? And Carrie McKee from CBC London, will family doctors also be offering the booster shot?
Yeah, thanks for that question, Jen and Carrie. We've booked over 12,000 appointments since Friday. The number of appointments booked since this morning is changing rapidly, so I do not have a specific number for you. But we are seeing our appointments fill up. We are adding appointments as we are able to add staff over the next 10 days. So again, for people that are thinking of booking, go and book, visit our website. I hope you should be able to find an appointment. Again, we're adding appointments as quickly as we can, and also check out your local pharmacy. Family physicians and primary care are also areas where vaccines can be offered. We have the ability to distribute vaccine to primary care across our region, and many of them have taken advantage of that over the last number of months. So certainly speak to your primary care or family physician about that, recognizing that there's lots of other competing demands for primary care as well. I would also note that primary care and family physicians are a key part of helping us run our mass vaccination clinics as well, and we're grateful to them for that.
Thank you very much, Dr. Summers, for that response. Another question here from Jennifer Beeman with the London Free Press. Dr. Summers, how critical of a health threat is the Omicron variant to fully vaccinated people? Are they still largely protected from the worst outcomes?
Thanks, Jen, for that question. There is substantial unknowns in my answer. The estimated effectiveness of the vaccine, fully vaccinated, to the Omicron variant when it comes to symptomatic illness, so the infection, is potentially 20 to 30%, which is a notable loss in effectiveness of the vaccine against the Omicron variant for symptomatic illness. However, we anticipate more protection against severe illness, hospitalization, and death. However, we don't know how much protection. We just don't know. And the challenge is that with the rate of increase in cases, that we probably can't wait to find out. So we need people to take some of those extra precautions and get your booster dose if you're eligible. The booster dose appears to increase the vaccine effectiveness from 20 to 30% potentially against symptomatic illness, all the way up to 70 to 75%, which is not nothing. That is a substantial increase, which is why vaccination remains absolutely critical. I'd also highlight, just in my quick answer to hospital vaccination, that vaccination helped us avoid a Delta wave. This, in fact, is looking like our fifth wave. We had no fourth wave because of the vaccination efforts, and those efforts cannot be understated with regards to how important that was to our system this fall.
Thank you, Dr. Summers, for that response. Another question here from Jennifer Beeman with the London Free Press. It is for Dr. Summers and Dr. Dukelow. The Ontario Science Table says the reproductive RT of Omicron is three times what it was for other variants. With our vaccine coverage rates and indications Omicron may cause milder illness, how much of a threat is an Omicron surge to the health system?
I'll just quickly say that the models are not encouraging because of how many cases may end up infected with COVID-19 because of the infectiousness of Omicron. The unknown variable is how severe those cases are. That's the unknown variable. Our vaccination coverage gives us a huge leg up, but that unknown variable of how severe the illness is what is unknown with regards to the impact on the health system. It's an unknown variable, though, that we won't necessarily know the answer to until the ship has passed.
Thanks, Dr. Summers and Beth. I'll just add that even prior to Omicron being even as well known as it is now, the Ontario Science Table released some modeling on December 7th, so I guess a week ago today, that highlighted we were going to see a surge in hospitalizations and ICU admissions in sometime in January, where ICU cases were declining, and this is publicly available, to between 250 and 300 patients across the province, which would be similar to wave 2. They also, within that modeling, made some predictions around Omicron, but the confidence intervals or the ability to predict is not super accurate, given what we don't know at this point in time. So we do expect an impact on the healthcare system based on what we had before Omicron, and now with Omicron, it is unknown because, as Dr. Summers mentioned, even if most cases are mild, when you have that many cases, you will have some people in the hospital and impact the healthcare system.
Thank you very much, Dr. Dukelow and Dr. Summers, for that response. Another question here from Jennifer Beeman with the London Free Press. Dr. Dukelow, can you provide any more details about the 11 staff cases reported at LHSC? Does LHSC have any high-risk contacts of these cases self-isolating?
Thanks very much. So I'll start by saying we don't have any outbreaks at LHSC at this point in time, meaning that there has been no provider to provider or provider to patient or patient to provider transmission within the hospital of COVID cases. So my assumption is that those 11 staff cases were acquired outside of the work environment. If they did have contacts within the hospital that were potential risk, according to how the health unit defines it, or our own occupational health, then they would be isolating at home as per the direction of the health unit. But there's been no staff-to-staff transmission at this point in time.
Thank you very much, Dr. Dukelow. Another question here for you from Jennifer Beeman with the London Free Press. Dr. Dukelow, is LHSC building capacity for a potential COVID-19 surge driven by Omicron, or is it still too early to determine the impact of the variant?
Thanks very much. It's a great question. we are building capacity, and we have been for the past few weeks, not just based on Omicron, but based on the modeling that's been released showing that we will see an increase in ICU cases. And like Dr. Summers mentioned around the Health Human Resources being extremely fatigued, and staffing is very challenging right now in all health sectors. We continue to staff the Carling Assessment Center, as well as likely be helping out at the Agriplex, and
comes to us from Sawyer Bogdan with AM 980 CFPL Global News. It is for you, Dr. Summers. Dr. Summers, Kingston is limiting gatherings to a maximum of 5 people. This comes into effect at 6 p.m. tonight and is in place until December 20th. This is in response to Omicron. Would the MLH2 consider dropping its recommendation down from 10 to 5?
Thanks for that question, Sawyer. Yeah, the Kingston, Frontenac, Lennox, and Addington Public Health Unit released Section 22 this morning. They have seen pronounced increased and severe increases in Omicron transmission, limiting gathering limits. The key thing in all of this is, one, Kingston is seeing pronounced more cases than we are at this time, and that truly with Omicron, this is now a province-wide challenge. The borders between different health units are porous. People go from here to there, and therefore we will need, if we are going to see ongoing rise in cases, we will have to look at measures that impact the entire province. We will continue to monitor the cases here locally, as well as what is working to stem the rise in cases and respond accordingly. At this point in time, again, it is really clear that provincial interventions will likely be necessary given the pervasive spread of Omicron in order to avoid this ongoing surge in cases if we continue to see the trajectory that we're seeing right now. Again, I know that the province is aware of all the data across the province, and my recommendations from earlier in the media briefing today stand. It is critical that people, even in the absence of restrictions, begin to limit their close contacts in an indoor environment as much as possible.
Thank you very much, Dr. Summers, for that response and that advice. Our next question comes to us from Heather Senerin with CTV Kitchener. Dr. Summers, this question is for you. Heather is looking to chat about and to ask some questions about cases associated with a recent hockey tournament. I believe it's the recent Dan Pullum hockey tournament that was held in London. Heather would like to know how many cases are linked to Omicron associated with this tournament, and do you know how many teams were impacted?
Thanks, Heather, for joining us, and thanks for those questions. Yes, we are aware of a cluster of cases associated with that tournament. At this point, 18 cases have been linked in the Middlesex-London region associated with one team. And 14 cases associated with a team from Waterloo. I will note that there is tremendous interactions and potential exposures both amongst these teams prior to the tournament, after the tournament, during the tournament, at the rink, hotels, you name it, lots of interactions. And those are the types of activities that need to be halted in the next little while. We are seeing transmission amongst amateur sports, particularly amongst amateur hockey teams, with kids under the ages of 12 who are therefore unvaccinated. We are reviewing exactly what may be helpful to reduce transmission in those areas, but regardless, what we do to limit transmission in social, comfortable, private events and dwellings will be absolutely critical because we're seeing transmission in those settings.
Thank you very much, Dr. Summers, for that response. Our final question in the queue this evening. There's two questions here, actually, from James Tirani with CBC London, and we'll ask them together for you, Dr. Summers. This is regarding Queen's University, who has canceled their in-person exams. James from CBC London, Dr. Summers, would like to know, does MLHU anticipate that they'll recommend Western does the same? And the second question is the same. So just the one question there for you, Dr. Summers, this afternoon.
Yeah, thanks for that question, Jane. We are in active conversations and have been working closely with Western's health and safety team as we have since the beginning of the pandemic. Should there be any changes in protocols, you will hear that directly from Western around how they will operationally deliver their educational programs. We are talking regularly, and they're very aware of the rising incidents that we're seeing, the need for distancing where possible, balanced with essential operations, and we'll continue to work and talk with them.
Thanks very much, Dr. Summers, for that response. That leaves us with no more questions in queue this afternoon. So I'd like to thank everyone for joining this afternoon and for tuning in. We will be back on Thursday afternoon at 2 o'clock. Thank you.